So good afternoon, everyone. My name is Denise Octavia Smith, and we're going to get started with our webinar today. If you're just joining, if you could please mute yourselves as you come on so that we don't have the background hum or conversations. We know lots of folks are multitasking. I want to welcome everyone to this webinar, the results of a national survey of CHW Networks. We believe that this webinar is going to provide some insights that should guide increased investment, integration, and hopefully partnership with our CHW networks and associations across the country. I have the great honor of being the founding executive director of the National Association of Community Health Workers. My name is Denise Octavia Smith, and if this is the first time that you're joining us on one of our webinars, I'll take a couple of minutes just to level set on the National Association. I came on as the founding ED in November 2019, and I am a community health worker. Had been working in the state of Connecticut for about 15 years before I was fortunate enough to have the opportunity to come on board. And I just love to take this moment and acknowledge many of the folks that you're seeing on this slide are my peers, they are my mentors, they are my colleagues in the CHW space. Community health workers, as and as many of us have known, have timeless origins with deep cultural connections to our work and a calling for compassionate service. We engender trust in our communities through our lived experience, our culturally appropriate communication, our commitment to build support services and systems and bridges to advocate for and build the capacity of our communities with the goal of improving the whole health and well-being of individuals and communities. Working upstream to address community violence prevention, as my friend Brother Dean is here, or if you are working to advance the profession and create a pipeline for health careers and employment, or if you are a CHW who is now leading an association or network across the country, as my friend Milagrosa is, or whether you are a community health worker who is advancing policy in your state. You are critical not only for emerging and urgent needs, but address and impact whole systems and to drive innovation and equity. And I am so honored to have the opportunity to lead this association. Community health of growing evidence. We draw from our partnerships with academic institutions, with private hospitals and other organizations, with health departments, community-based organizations, to build receptacles for our collection of evidence and effectiveness of the work that we are doing, again, for downstream service delivery, as well as impacting services and systems. Here you see the ASTHO brief that came out just this year in January, showing the evolution of an increase of studies on community health workers. The Patient-Centered Outcomes and Research Institute over the last 10 years has invested nearly $300 million to fund dozens of projects around comparative clinical effectiveness research. And also this work, this movement around evidence, this dissemination of effectiveness has led to a movement and finally a classification for community health workers with the U.S. Bureau of Labor Statistics. As well, the National Association of State Health Policy reports that there are 47 states that are active right now in a variety of ways to address the financing, education, and or certification of community health workers, to advance and clarify state CHW legislation, and to support and build organizations and work groups such as our many CHW networks and associations that we're going to be talking about later on today. The National Association builds on a number of policies that have emerged over the decades, in large measure through the infrastructure and around the organizing of the American Public Health Association. I won't read through all of these policies, but NACHWA, we build upon and promote these policies with public and private institutions to really understand and recognize CHW's contributions to U.S. health and institute focus around health equity and the way that we contribute to the elimination of health disparities. We are urging with APHA, state, federal, and tribal governments and private insurers to directly reimburse an expanded and well-rounded scope of CHW services. We always are promoting CHW self-determination. We are a workforce that should always be at the center of workforce decision-making processes happening at the public and private institutional level. And while NACHWA does not promote any specific training program, certification program, or curriculum, we offer to our public and private partners around the country the CHW Core Consensus Project as a set of tools and guidance that can serve as a basis for development with local community health workers to develop training programs and curriculums that advance the workforce, that are centered in our values and articulate our roles. And so on the basis of all that I just shared, and after many decades of work and organizing of CHWs and allies around the country, the National Association of Community Health Workers was finally launched in April 2019. Our vision is community health workers united nationally to support communities in achieving their health, equity, and social justice. We are uniting CHWs across sector, across geography, across ethnicity, or unpaid. We work on a number of different fronts to engage CHWs, allies, supporters, and our partners. We are expanding our membership across the country and the recognition force and opportunities for collective action. We are enhancing CHW leadership skills and opportunities for leadership, most specifically in our CHW National Ambassador programs. We work diligently to educate stakeholders about the impact that CHWs have, again, on downstream service delivery, as well as on our leadership in transforming systems and policy, establishing the National Association as a voice to promote sustainable strategies on issues related to the workforce. Our partners across the country are CHW Networks, associations, individual CHWs, ally organizations, and many supporters. And we build those relationships on our shared values that you see here on the right side of the screen. Just a note here, sometimes people have asked me if our networks and associations are chapters of NACHWA. The short answer is they are not. and we acknowledge their leadership. And many of those leaders have formed the founding board of the National Association of Community Health Workers. But we are promoting and highlighting the excellent work and the importance of national networking across this partnership. So a few data points about our membership. NACHWA has members currently in 46 states. This slide just shows the states with the top 10 membership across the country. And so you can see that we're reaching deep into our southern states, through towards the Midwest, and of course along the eastern seaboard. Our membership is working in a variety of different areas, including research, working through clinics and federally qualified health centers, working on community organizing and care coordination. And our membership reports a variety of areas, including gender-specific health services, working with special needs populations, as well as working upstream around social welfare and economic opportunities, housing, and immigration. Not all NACHWA members are formally employed. Again, we are creating a very intent of the workforce, but for those CHWs who are our members who are employed, this graph just shows you that the majority, almost 60% of them, are rooted and working in community-based organizations. We want to give a special thanks to our founding partners who have come alongside of NACHWA at our birth to make sure that we can advance a national strategy, that we can build an infrastructure that is meaningful and responsive to the needs of CHWs individually and our CHW networks and associations. Well, I would be remiss if I did not acknowledge the time that we are in right now. For the last several months, every one of our lives, the lives of our friends and families, our work life, our community life has been profoundly impacted by the COVID-19 pandemic. During these last several months, Community Health Workers has made it a priority to be present in a variety of different spaces and on a variety of different platforms to clarify and articulate the roles that community health workers can play, the skills and qualities that we bring as critical, essential infrastructure workers and first responders during COVID-19. We have partnered with the American Diabetes Association, the Centers for Disease Control and Prevention to offer English and Spanish webinars that help CHWs to do their work better on the ground. We have been grateful and fortunate to be part of national strategy calls with Health Begins and other national partners who are advancing a community-focused agenda around COVID-19 that is rooted in equity and resiliency and recovery. We've had the opportunity to advance the leadership of CHWs through podcasts. We had a recently released article in the May 6th Health Affairs blog that really offers ways to articulate that we can strengthen public health response through the deployment and partnership with community health workers. And of course, we're advancing some key messaging and points to amplify the workforce during this time. This webinar is so timely, and our speaker for today, Jeff Wilkinson, and I actually thought about this webinar several months ago. So it's wonderful that we are coming together now and offering this to everyone on the call. For our country to seize this opportunity where we are coming together like never before to address historic inequities, urgent urgent needs for contact tracing, testing, and access to health services, and thinking forward to the ways in which this pandemic will transform our service delivery and give us opportunities to invest in our communities for the long term. NACHWA is really prioritizing the role of CHW networks and associations. We are working with our networks and associations across the country to promote a shared understanding of CHW roles during this time. We are supporting them as they support their states and localities to coordinate workforce planning, implementation, and monitoring efforts. We are supporting public and private partnerships that are emerging with our networks and associations, making those meaningful connections and offering assistance. We are promoting that public and private institutions look for opportunities to strengthen the capacity of CHW networks and associations to really prioritize and commit to community recovery and resiliency efforts in this time. And we're encouraging and supporting our associations and networks to document the excellent contributions, the groundbreaking innovations, and the lessons learned that are happening at the local level. We will need your stories, we will need your data, we will need your perspectives so that we can learn all that we can in this time and apply those lessons learned to the future. So without further ado, and with that as a basis, I'd like to just ask Jeff Wilkinson to come off mute and to introduce himself. I am so grateful to have Jeff as a founding board member of the National Association of Community Health Workers. He is the NACHWA treasurer and was also a lead in this study that he'll present to you today. Jeff, are you with us?
I am. Can you hear me?
Yes, we can. Please introduce yourself and thank you so much for joining us today.
Good afternoon, everybody. I can't tell you how excited I am reading this chat and seeing how we have people from literally all over the country, even in Hawaii, joining us. So it's a privilege for me to be able to talk with you and to share this afternoon's webinar with Denise. As she mentioned, I'm a founding board member of NACHWA, and we started work intensively in 2015 and building the organization. And we recognized that there was a network of CHW organizations around the country, and we imagined that without any intention of them being chapters of NACHWA, that they would provide an incredibly important base for building the CHW movement. And for those of us who have been on the board from the inception, I think there's a very clear sense about that this is about building the CHW movement nationally. I've been a supporter and ally of the workforce for close to 20 years in multiple roles, including as the director of the State Public Health Association in Massachusetts, where I was involved in some seminal policy work with folks who many of you know, Darrell Fox, Lisa Renee Holderby Fox, and the then very new Mass Association of Community Health Workers. I moved into government and was involved at the Massachusetts Department of Public Health as a senior manager there in the commissioner's office. And I had responsibility for supporting Gail Hirsch, who many of you know who is the director of our office of CHWs, and I was the founding chair of the Board of Certification for Community Health Workers, and work closely with CHWs to get Massachusetts's certification program underway. I teach now at the Boston University School of Social Work, and am spending a lot of time with NACHWA with the flexibility that a professor's job sometimes allows. So let's get on with talking about this report, and I'll show you the front cover. We have the next slide. This is, next slide, please. Waiting, there we go. So this is the front cover of the report, and let's back up one, please. And I want to just mention that this report is available, and I provide a link at the end of the webinar slides so that you can see the entirety of the report. We did this as a project between NACHWA and the Boston University School of Social Work with great help from Katie Sitkawi, who was then the administrator assistant for NACHWA. Next slide. The reason that we wanted to have this report or this study was to find out where the CHW networks were and what their capacities and characteristics were as we were thinking about building a national organization. Next slide. And so we had Lisa Renee Holderby-Fox had worked as a consultant for the C3 project, the CHW Core Consensus Project. And many of you are familiar with C3 as a project nationally to establish standards and define core competencies for CHWs. They had done some outreach to try to find CHW organizations, and we worked with that start of a list and then dug much deeper and did the first and still only comprehensive national survey of CHW organizations. Next slide, please. So we were doing this in order to inform strategic planning to develop the National Association and to think about an organizing approach for the workforce. So between basically late spring and early summer of 2017, we distributed a survey electronically with 26 questions. We sent it out to, I think, 56 different possible respondents. Really made a lot of calls, a lot of emails, a lot of follow-up, and finally got 40 discrete different organizations included. We got more respondents than that. When we cleaned up the data and eliminated duplicates, we had 40 discrete organizations across the country. And I should say that we provided a report on preliminary results of the study at 2017 at the American Public Health Association. There was a large group there, and several people came up and said, "We didn't get the study, we want to be in it too." And so we actually opened up data collection again for several months at the end of 2017 and added 4 different organizations. Next slide, please. I want to show you where these organizations are located across the country. Next slide, please. There we go. So the states, no, one back, please. I want to take a look at that map. Thanks. So again, this is in 2017, and we're 3 years down the line. And so I want to hasten to say that the picture may be a little different than it was there, but this provides us a baseline. And the states colored in blue were states where we had organizations responding. Next slide. Next slide, please. There, thank you. Denise mentioned earlier that some of these organizations have been around for decades, and you can see that the first of them that we were able to identify was back in 1997. There has been very rapid acceleration over the last several years in the development of these organizations. And so it's entirely likely, if you take a look, for instance, at the stretch between 2013 and 15 or 16, or 2014 to 17, there's some rapid growth there. And it would not surprise us to learn that there have been more organizations formed over the last couple of years. Next slide. Thanks. So I'm going to tell you a little bit about what we learned from some of these organizations. We've tried to just summarize the data in this discussion so that we'll have time for questions and answers and discussion with you. I'm not going to try to present all of the data that we found, but I do want to give you a profile, and hopefully this will give us a nice overview about the characteristics of CHW organizations around the country. First of all, they call themselves different things, and association is the most common way that CHWs describe themselves. But That's followed closely by network, coalition, alliance. So these organizations may be called different things. Our goal was to find organizations that counted themselves as membership organizations, not organizations that advocated on behalf of CHWs, although there are some in this survey, but organizations whose members are CHWs, whose leaders are CHWs. So we found out that organizations describe their membership or count members in very different ways, or a number of ways. So 28% of the total sample defined membership formally. That is, in order to be counted as a member, somebody had to take an action to join. They had to sign a membership roster or list. They had to make a dues payment. They had to do something affirmative to say, yes, I want to join this organization. 26% defined membership informally. Now, anybody who came to one of our meetings and signed a sheet, an attendance sheet, and who we put on our mailing list, we're calling a member. We're communicating with them. They may be involved in our work. They're a member. And 41% use some combination of formal and informal processes. Next slide. Next slide, please. Thanks. Most of the members of these organizations are CHWs. 33% reported that all or nearly all of their members are CHWs. And another 27% reported that half, about half or 2/3 were their members. So altogether, 2/3 of the total organizations reporting this in this survey reported that at least half of their organization's members are CHWs. Next slide. So these organizations vary a lot in terms of their characteristics. About 2/3 of them reported that they had fewer than 200 total members. Their membership ranges were from less than 100 to over 1,000. Now that may be in part because 40% of the organizations that responded reported that they are affiliated with some other organization or use another organization's 501c3. But most of the organizations are fairly small. 2/3 of them have less than 200 members. The organizations that are larger tended to be older. And we had several networks reporting over 1,000 members. These were the oldest among them. So of the smaller organizations, almost all reported budgets of less than $50,000, and almost all of those collected membership fees. I'll say a little bit more about these smaller organizations in a couple of minutes. Next slide, please. Members are engaged in the work of these organizations in different ways. Almost all have a governing board or executive committee, 85%. Almost 2/3 use work groups. 40% hold annual meetings. 17% of them hold standing committees. So the structure of how organizations work vary a lot. The next slide. Majorities of CHWs tend to govern. Of the organizations that reported that they have governing boards, which as you saw is just about 85%, almost 3/4 of those reported that a majority of their board members are CHWs. 2/3 of those boards meet at least monthly. Almost 3/4 met both in person and remotely. And again, of course, this was before COVID-19. But so the takeaway here is that these organizations across the country tend to be governed by majorities of CHWs at the board level, which is encouraging for us. This is who we want to be working with as a National Association of CHWs. Next slide, please. These organizations are doing a lot of different kinds of work. So the bar chart here plots the numbers of organizations involved. You can see that all of them almost all of them are involved in professional development. That was the largest. And a number of them have members attending conferences at different levels, state, local, national. Well over 3/4 of them provide training for members or other workforce members and interested parties. They're providing information about the workforce to employers, to policymakers, the public. 25 of the organizations were involved in legislation or regulatory work. They represent CHWs on commissions, panels, and other ways of becoming involved in public policy making and discourse. And it was also interesting that almost half of the organizations reported that their members are involved in research, which underscores one of the core competencies defined for CHWs in the C3 project. And we get pushback sometimes when people define who are CHWs, but I think there's not adequate appreciation of the extent to which CHWs are actively involved in research. So there is a lot going on in these organizations, and it provides an incredibly rich base of engagement for a national organization to tap into and to support. Next slide, please. Board meetings we're meeting, at least this is pre-COVID, so we're not sure. We assume that, like the rest of the world, that these CHW organizations have moved online. But over a third were meeting at least monthly, and another over a third, so close to 3/4 are meeting monthly or every other month. And then another close to half meeting 4 to 6 times a year. So in other words, the takeaway for us is that the folks in these organizations around the country are meeting regularly. They're in touch with each other. These are not just paper organizations, but these are groups of people who are quite actively engaged with one another in productive activity. Next slide, please. 40% of the organizations have their own 501c3 status, and 45% were affiliated with or used another organization. So there are different organizational models out there, and the national organization is a hybrid itself. We are a 501c3, and we use another organization as a fiscal sponsor as a cost-saving method, and to take advantage of a range of other organizational supports that we get with that partnership. So I think it's important to recognize that just being a standalone 501c3 does not accord superior status to an organization. There are all sorts of different models that are working for people around the country. Next slide, please. So when we think about organizational capacity, it's important to think about staffing and budget. And of all the responding organizations for the survey answered the question of, do they have staff? And over half, 22, did not have staff. 16 did have paid staff. A couple weren't sure. And of the organizations that had staff, 15 had full-time staff. The median number of full-time staff was 2. That is, half of the organizations with staff had 2 or more, and half under. So it was these. I think the takeaway is that the organizations on the whole do not have a lot of staffing and cannot. And so these are voluntary organizations run. The majority run by their boards and voluntary leadership. And for the organizations that have staff, they don't have a lot of people working for them. But this is, on the other hand, when you think about a national network of CHWs and the difficulty it is to sustain organizations, this is an extraordinary start for us. Let's move on to next slide and talk a little bit about funding. Again, the picture is that these are not rich organizations. They're modestly funded. 2/3 of the respondents have budgets and do raise funds. About a quarter did not. There were a few respondents that were not sure. As you can see, that the size of the budgets varied, but most of them are marginally funded. So we've got 14 of the total 27, or that is just over half of those who raise funds have budgets of less than $50,000 a year. There are some larger organizations, and it wasn't clear in the responses. They may be counting the full budgets of their sponsoring organizations as well. Next slide, please. Of the organizations that are raising money, that have budgets, 2/3 roughly receive foundation grants, 63%. And about half also earn fees for services. So they're doing training, they're getting paid for it. They may be providing some consulting services and getting paid. About half also charge membership dues across the country. So as you can see on this chart, there are a number of different sources. It's like any nonprofit, any community-based organization is getting funds from a variety of sources. I think kind of buried here is the kind of good news that foundations all across the country are supporting CHW organizations, recognizing the important work that they're doing. And so this represents some opportunity for the network across the nation. Next slide, please. So I'm just going to wrap up and make a few overarching points. That there was tremendous enthusiasm among the respondents to this study for launching a National Association of Community Health Workers. Remember, this was done in 2017, and we were at that point close to 2 years away from our founding convention last April in 2019. 3/4 of the respondents said that they were definitely interested, and almost all of them said that they were somewhat or very interested. We are already at work in the ways that Denise described at the top of this webinar in helping to build organizational capacity for the national network of CHW organizations at the grassroots. I think we are also interested in, at the national level, in the ways that the strength of these organizations can build a national movement and strengthen NACHWA. So as we provide training, for instance, on advocacy, the grassroots organizations that are working at the state and local level are going to be able to inform our efforts very richly with their grassroots experience. And we could go through the whole range of the kinds of activities that we can do where that grassroots knowledge, that grassroots engagement gives a national organization and a national movement strength. On the other hand, there are significant challenges with capacity. Not a lot of money in these organizations, not a lot of staff, and kind of inflow and outflow of leadership. As Denise has reached out to these organizations, she has found that some of the contact information we had 3 years ago is no longer reliable. And so clearly, with any kind of a relatively small grassroots organization, there are challenges to capacity. And so we've got to identify those, reach out and support those organizations. But that's what we are doing now. And it's an incredibly important time, especially with COVID-19, to see such interest nationally in this workforce, to recognize the power of CHWs, the unique capacity of CHWs, and we're looking forward to building on what we learned in this study. Next slide. So I want to show you the link to the full report of the study. This is available on NACHWA's website. And I saw an earlier question. I have not been reading the questions and comments in the chat as I've been talking. So I trust that Denise and Nina, our executive assistant, will help with this. But we're going to move into a discussion now. But one of that question I did see was, will the slides be shared? And Denise, correct me if I'm wrong, but I think the answer is yes. So you'll have an easy link to this, but you can find it easily enough on NACHWA's website. Next slide. So we're going to open this up for discussion now, and I will turn it over to Denise to moderate that. Thanks very much, everybody.
Thanks so much, Jeff. I have been monitoring the chat. Hopefully I've done a good job. And I want to just lift up a couple emerging conversations for starters, and then we can start to take individual questions. If you're just on the phone, I know it might be difficult for you to share with us, but if you have access to the chat, you can type your question in the chat. And I've also been posing some questions that are in the chat if you're a CHW network, if you're an ally organization, so you can think in that context and contribute to the thought and the conversation that way. So Jeff, let me just pose this first broad question, which is how allies can really support the development of CHW networks and associations.
That's a great question. And as an ally, I'll say that I think probably that the axiom, the first thing is with great humility and with respect for the principle, nothing about us without us. Leadership has to come from the CHW workforce. And I think if we start from that as allies, then it puts us in good stead. But there are a lot of different ways that allies can support these organizations. And I think asking the leadership of these organizations is the most important thing to do. Allies often come from, with professional skills. They come from organizations that have resources. They often have more flexible time because of their professional roles than members of the workforce who are still, unfortunately, not adequately respected in a lot of their workplaces and not given the flexibility to participate. So I think that recognizing the really heroic efforts that it takes for CHW leaders and members to start up and run these organizations is an important thing for allies to keep in mind. So just I think a humble, engaged, and respectful offering of what can I do, how can I help, and then taking it from there as the different needs of the organizations arise. I would be very wary about trying to represent the workforce in public. And I think, again, it's important for allies to be taking the lead from their leaders in that regard.
Thank you. Here's another question. You know, you shared a slide earlier just helping us to understand that CHW networks and associations have been in development over a number of decades. And there was a question in the chat about where should, I don't know if it was allies or CHWs, where should they look if they're interested in starting or growing a network? What kind of startup support or what kind of guides are available? Certainly this report helps folks to understand where their peers are as CHW networks associations and how they're operating. And I think I had shared with some on a previous call that just this April, Idaho launched their CHW network and association in the midst of this pandemic, which I think just shows the commitment and the extent to which they were building their organization and have that commitment outside of this emergent issue. But what are the guiding tools, the guiding approaches when CHWs or CHWs and allies are coming together and want to grow a network?
It's interesting that you ask. One of the first things that we did as a emerging national organization was, with sponsorship from Sanofi, held a national series of webinars for organizations around the country providing guidance on just this topic. I don't remember if we have those slides available on NACHWA's website, but we can get them up there. And they included a variety of organizational considerations and some tips on strategic planning. Other than that, I'm not aware of any how-to guide, and it's a helpful question. I think it's one we'll take back to the board and think about what NACHWA can do to provide that kind of guidance. Certainly be in touch with Denise if you have that interest. One of the things that I do is to consult to the Association of State and Territorial Health Officers, to state health departments with my partners, Carl Rush and Terry Mason. We've worked with a number of states across the country, and I know that a number of state health departments are either involved in now or interested in being involved in partnerships to help launch and support CHW associations. So it's worth checking with folks in your state health department about that. I think it would also make sense to figure out if you're interested in starting such an organization, make sure there's not one already going in your state. And we can help identify those organizations, make sure we're not recreating the wheels, and strengthen organizations that are already started. I think it's fair to say that we would be very happy to talk with you if you have this interest. We can link you with other people around the country. That's one of the things that NACHWA is here for.
Thank you. Okay, there's another question that is sort of directed to me, or at least I can take it, and it asks, is there some thought to having the state CHW organizations formally affiliating with NACHWA? So as I mentioned earlier, our network and associations around the country are not chapters of NACHWA. Many of them are much older than the National Association. But we have, particularly in the last 6 months that I've been here as the founding ED, we have reached out to networks and associations across the country, and we're doing a number of things. I think many of them are in the context of COVID-19, and that is sharing and developing materials that we can co-brand that articulate the roles and the opportunities for public and private institutions to come alongside the workforce, and also to partner with CHW networks and associations as anchor institutions in this community with existing membership that is diverse and skilled to reach deeply into communities with messaging and capacity building and advocacy around COVID-19. And so there are many opportunities already where NACHWA and the networks and associations are coming together. If you are a network or association and you're on the call and you have not connected with us in that way, you can email me. I'll throw my email in the chat, and we can link you to the town hall calls that we're having specifically with CHW networks and associations to make them aware of some of the stimulus that has come through related to COVID, of some of the opportunities for contact tracing training, or other opportunities that are coming through CDC or the American Diabetes Association or many other networks and associations, so that you can gain access to that training information, so that you can connect with your other peer leaders and begin to mentor one another and share lessons learned. So let me check and see if there's another question in the chat. There's one question that is coming around. It says, any suggestion on how we balance the desire to formalize CHWs in the medical delivery system while staying true to our mission? There is a risk that CHWs will be used to fill gaps at CBO's medical systems and become over-medicalized. Well, Noah, I'll say a couple of things and then I'll let Jeff respond. I'll make an assumption that the folks on this call are well aware that those things that affect or impact our health, 60 to 80% of those factors happen outside of the clinic office. They happen outside of the doctor's office. We often refer to those as the social determinants of health or the social drivers of well-being. And while there certainly is concentrated funding in medical systems, it is critical if we are to achieve health equity and eliminate disparity, that our systems move in the direction, which I think Rishi would say upstream, so that we can finally have the type of data, the type of integration, the type of efficiency, and the type of equitable approaches and interventions that will prevent disease, that will develop resiliency, that will address those strong indicators of poor health outcomes like housing, like food insecurity, like mental health or behavioral health. So while many CHWs are connected to hospitals, clinics, federally qualified health centers, the data that I shared earlier said that a majority of CHWs are still rooted in community. And I believe that our systems at the state and federal level are moving upstream to address cost effectiveness, to increase the access and quality of care. Jeff, did you want to add anything to that?
Sure, thank you. I want to just acknowledge the importance of the question, and this is a topic that is controversial even among some CHW leaders around the country. Should there be certification of the workforce, for instance? And so I think it's important to recognize that this pressure by the medical system to medicalize the role is a real one. And if CHWs are in the lead of discussions involving policy related to the workforce, there is a lot that can be done to anticipate, to describe in ways that CHWs can best do by virtue of their experience in these roles and the pressures that they face and the disrespect that they sometimes experience and the enormous respect and integration that they sometimes experience. They can inform those policy discussions. And we know, having been involved in several different professionalization efforts, that you can anticipate a lot and you can build certification programs that anticipate and prevent some of the abuses that, if not properly anticipated, could in fact be real problematic. The other important thing to recognize is that many CHWs are not involved in the medical system. This goes back to the heart of what Denise was just saying. The American Public Health Association defines CHWs as a public health workforce. And that work of public health is going on in a wide range of community-based organizations and issues involving primary care, not just work in the health system.
So Jeff, there's a question about the map that you presented earlier. Will it be updated? So let me just bring it to a broader question after you answer that one. The person says, I noticed a few states that now have state CHW organizations, but were not highlighted. What is the next iteration of this report? What else do we need to know about the CHW networks and associations? And what do partners or allies need to know to develop a stronger and a sustainable relationships?
I would love to turn that question back and see some responses in the chat about what else you would like to know on this call. We don't currently have plans to redo the study. We are focusing our attention on outreach to the organizations that we've identified, and of course, to any new ones that we learn about. We won't update the map in the report because the report is published and done. But we will be updating a map on NACHWA's website so that we can see where these organizations are. And I think it'd be useful for us to know, what do you want to know? And we, as a new organization with one full-time staff person and the incredible set of challenges and opportunities that face us, we have to be smart about how we use Denise's time and the time of board members. So let us know what you want to know as we're following this chat, and we'll make a decision about whether it's a short-term priority to do this study or publish updated information.
Thank you so much. Is there a question? I know not everyone can type their question into the chat, although many have. And if there are questions in the chat that we haven't gotten to, we'll copy the chat and we can reach out to you. Would anyone like to unmute themselves? We have a couple of folks from around the country who are interested in starting networks. So we encourage you to reach out to us so that we can have those conversations. Folks are asking to have the map updated periodically. So
we'll do it.
Yeah, we appreciate that. Let's see if anyone is raising their hand. Let me just scroll through and see if there is a question here. There's a question, has there been any collaboration between CHW and accountable care organizations that you know of?
Yes, there are accountable care organizations that are employing CHWs, and some states have used their federal district waiver funds to really center the work of CHWs in models that are being considered for sustainable work, and that involves accountable care organizations in several states.
Okay, can I tell you a little bit more about network town halls? Sure. So around mid-March, I started reaching out to our CHW networks and associations, understanding and also hopeful that they would become anchor institutions in response to strengthening our public health systems, again, for the urgent need of a contact tracing and kind of expanded care coordination and mobilizing community to help people access testing, et cetera, but also for the long-term rebuild and recovery. So we've been reaching out to the networks and associations. As Jeff mentioned earlier, sometimes the leadership may change and we weren't able to identify and connect with all of them. So if you're a network or association and you have not been invited to our town halls, we share updates of what's happening at the state level, contact tracing initiatives, other COVID-19 response efforts, the ways in which CHWs are coming together and organizing for emergency response around food or other services or social needs. We're sharing those lessons learned, we're sharing materials, we're coming together around shared language and strategies because I believe we are going to be in this response, which is what we're in right now, still standing up response efforts and recovery for the foreseeable future. So I've put my email in the chat, and I would love for you as a network or association to reach out so that you can connect with your peers in this way. Okay, let's see. Are there other questions? There are many, but we are just at time. So please, if you didn't get your question answered, throw your email into the chat box. We're getting lots of thank yous and some information or questions that are specific to COVID. And I can go ahead and try to answer those questions as best as possible. Jeff, final thoughts. You know, as I said, we thought about this months ago when we were not in COVID, just about sharing this survey information and really mobilizing our networks and associations and partners to support them. What haven't we said, or what is the next step that we should think about?
Two things. One is we have not invited participants in the webinar to join NACHWA. And that's really important. If you are not a member, please join NACHWA. It's easy to do. Go to our website. You can join as an individual CHW, as an individual ally, or as a representative of an organization at multiple levels of giving. We really need to build this national movement, and this is the workforce's voice. The second thing is I want to just acknowledge there's a question and couple of people have appreciated the question about the relationship between CHWs and social workers. Given the time, I'm just going to say that we are actually studying that at Boston University School of Social Work. It's a cause of some concern for me as a social worker, that social workers are sometimes not adequately respectful of CHW expertise, or sometimes feel threatened that CHWs are going to supplant social workers. I think that the most important thing to hear is to say is that there is a complementary relationship. Both workforces are arguably underutilized in the health system and in the public health system. And I think the future is looking very good. But NACHWA is going to be involved in helping to articulate that relationship. And I would love to hear from you. And it's easy to get in touch with me. If we could get that last slide advanced, we've got contact information here for Denise and for me. Well, I guess you've got Denise's earlier, but I'm just at gww@bu.edu. So send those questions to me by all means, and join NACHWA. Thank you.
Thank you so much. Thanks, everyone. I know your time is precious. We're grateful for your participation today. Please reach out to us. You can leave your email in the chat before you leave if you'd like to be connected to our newsletter. We would love to share with you updates and opportunities to partner with us, to become a member, and to mobilize and unify the CHW workforce and profession across the country. Thanks again, everyone, for joining us, and all the best to your communities during this time. Yeah, it's still coming in. Thanks.